All right. So this is dental anatomy review 5. Okay, in preparation for your dental board exam. So we have this is review 5. So it means there is 6 review lectures before this one. So if you haven't watched the other 6 review lectures, make sure you watch them before this one. Okay. All right. So let's get started. So this is a lecture on tooth structure and the anatomy of the pulp and the roots. Okay, so we have to know what kind of structures are found in the root and the pulp area of the tooth. Okay, so this photo shows the apical foramen. Okay, so this is the anatomical apex, as you can see there, and you have root canal, you have cementum dentin, you have the CEJ, cementodentinoid junction, CDJ, and then you have the pulp chamber, and you have here your CEJ. Okay, you have your enamel, your dentino-enamel junction, and they're showing the lingual surface of the tooth. That was an anterior tooth. This is a posterior tooth, a molar. So you can see here, I will show you where the pulp horns are. So the pulp horns, you can see that the pulp horns are almost directly beneath the cusps. Okay, and this almost the same here too. So that the pulp horns. All right, and then you have a pulp chamber. And you have secondary dentin depositing on the floor of the pulp chamber. Okay, that's secondary dentin. And you have, of course, you have a pulp canal, you have the canal, and you have accessory canals. So you have one accessory canal here and 2 accessory canal, and then you have the 2 accessory canals joining. So that's called anastomosis. Okay, and then of course you have supplementary canal. All right. So important tooth structures, you have the anastomosis, which is just described, apical foramen, cementum, the floor of the pulp chamber, the chamber roof. Okay, and then you have the actual pulp chamber, you have the pulp canal. Let me point out the, and then you have supernumerary canals, secondary dentin, and pulp horn. So those are important things that you're supposed to know. Okay. Okay, so the pulp tissue is the soft connective tissue which is found in the central portion of the tooth. Okay, so this is the central portion of the tooth. That's the pulp tissue. Okay, that's pulp tissue there. And the pulp tissue is entirely surrounded by dentin. So whenever you see the dark lines there, that's dentin. Okay. So pulp cavity. What is a pulp cavity? So pulp cavity is the entire central space inside dentin of a tooth, both the root and the crown, that contains pulp tissue in a vital tooth. Okay, that's a pulp cavity. And the pulp chamber is the portion of the pulp cavity which is located roughly in the anatomical crown. So the pulp chamber is located in the anatomical crown. So this photo will show you where the pulp chamber is, and then you have the roof of the pulp chamber, and then you have the floor of the pulp chamber, and on the floor of the pulp chamber you have secondary dentin. Okay, and then the floor of the pulp chamber here, that's why I said you have the secondary dentin. Okay, that's the floor. right here. Okay. All right. So it's a simple review, but very important before you proceed to answer or to review more difficult questions. Okay, in terms of endodontics and everything like that. Okay, so the pulp canal is a section of the pulp cavity which is located basically in the anatomical root of the tooth. So the pulp chamber is located in the anatomical crown. The pulp canal is located in the anatomical root of the tooth. That's where the arrow is pointing, okay? And the pulp canal may also be referred to as a root canal. All right, so this is a cross section, okay? So tooth roots with round cross-sectional outlines generally possess one pulp canal. So if the tooth root has a nicely rounded root, then it generally has one pulp canal. And tooth roots with more oval or elongated cross-section outlines, they often have more than one canal. Okay, so keep that in mind. And so review of the pulp horn. So the pulp horn is the pointed incisor occlusal limit of the pulp cavity. Okay, it is the incisor or occlusal limit of the pulp cavity. So remember that definition. And the height of the pulp horn generally corresponds to the height of the cusp above it. That's why I said the cusps are usually above the pulp horn, so you have to keep that in mind when you're doing your preparations. Okay. The longer the pulp horns, the taller the cusps. So the apical foramen. All right. So apical foramen is the constricted opening at or near the root apex. Okay. And through which, so the reason for apical foramen is because through the apical foramen you have nutrients and nerve supply to the pulp. They enter and exit. Okay. And the apical foramen is thus the apical limit of the pulp cavity. So what is the apical limit of the pulp cavity? Is the apical foramen, where the green arrow is pointing. Okay. So we have to differentiate. So the apical foramen is not the same as the root apex. Okay. Apical foramen is not the same as the root apex. That's a favorite question that they like asking. Okay. Apical foramen is the apical limit of the pulp cavity. Okay. It doesn't have to be at the apex. The root apex is the anatomical apex of the root, meaning where the root converges. Okay, the pointed area of the root. However, the apical foramen can be, usually it's like about half, so 0.5 millimeters. It's about 0.5 millimeters to 1 millimeter away from the apex of the root. Keep that in mind. All right. And then you have lateral canals, which I said accessory canals. So these are minute canals that are usually extend in the lateral or roughly horizontal direction from the pulp to the periodontal ligament. Okay. Lateral canals are most often found in the apical half of the root and are in the and they are the minor source of nutrient supply to the pulp. So that's the purpose of the lateral canals. There's so many lateral canals, then sometimes the endodontic treatment may fail if you don't do uh, if you don't use sodium hypochlorite, EDTA, and also lateral condensation. So supplemental canals. So supplemental canal is a root canal or a branch which is in excess of the normal number of the root canals found in a root. That's a supplemental. Okay. And they serve the same function as the main root canals, but they are not present in all teeth. Keep that in mind. Anastomosis, by definition, as I mentioned earlier, is an extra canal branch that horizontally connects the pulp canals with each other. Okay, so you have two pulp canals, and then you have one canal connecting the two pulp canals. So that's an anastomosis. Okay, a connection between two pulp canals is called anastomosis. Odontoblasts. So odontoblasts, these are cells that lay down dentin, as we reviewed earlier in the developmental stages. So odontoblasts line up the inner wall of the pulp cavity and are responsible for dentin formation. All right. So if you see here, you can see that you have odontoblastic layer, okay, which is where the arrow is pointing. This one, and then you have secondary dentin here. You can see the secondary dentin is right on the floor of the pulp chamber. Okay, and then you have enamel and you have the DEJ. So you have fibroblasts. You see that? So fibroblasts right underneath the layer of fibroblastic layer. Okay, so formation of secondary dentin. So secondary dentin is also called physiological dentin. It is deposited in a consistent, uniform manner as a part of normal aging process. Okay, so when you're depositing secondary dentin and physiological dentin, that's normal. Reparative or tertiary dentin. This dentin, we reviewed this before, so this is a good review again. So reparative or tertiary dentin forms in response to acute or chronic irritants such as caries, thermal function trauma, or mechanical causes. Okay, that's why sometimes you see somebody who has attrition, like the teeth have worn out almost to the dentin. Okay, like there's no enamel. But when you ask, are your teeth sensitive? They say no. That's because they have deposited so much reparative dentin that the dentinal tubules are no longer exposed. Okay. Secondary dentin is the dentin forms in response to normal physiological activities. It forms throughout life. All right. And you can see here where the reparative dentin is forming. That's the reparative dentin and that's tertiary dentin. Forming due to caries, right? You see that? And then you have secondary dentin here, which forms throughout life. So reparative or tertiary dentin forms in response to irritants, okay, bruxism, clenching, erosion, trauma, or dentinal caries. And then we have reviewed the pulp cavity and aging. We have compared in the previous review. We have compared young pulp versus adult pulp or aging pulp. So you have to know all those comparisons. So with the formation of secondary dentin during aging, the remainder of the pulp cavity normally decreases in size. So because secondary dentin is formed throughout life, it continues to form, and the more it forms, the more the pulp cavity or the pulp chamber decreases in size. Okay, which is the reason when you're about to do a root canal on somebody who is very old, or let's say advanced in age, then you may want to refer to a specialist, a odontist, because those canals may be calcified, and you may need a microscope to do it if you don't have one. So just keep those in mind. Okay. So in younger tooth, okay, in young tooth, the pulp horns are very prominent, elongated. Okay, and when you start to advance in age, the pulp horns may become blunted. Okay, these are favorite questions. Okay, pulp horns may become blunted or obliterated, so that the teeth of other individual may not exhibit pulp horns. And the outline of the pulp cavity generally corresponds to the external contour of the tooth. All right. And the anatomy of the cusp can even be used to determine the height and contours of the pulp horns, as we mentioned earlier, especially in the posterior teeth. So let's see here. So permanent teeth pulp horns, all permanent incisors contain 3 pulp horns, as we saw. So they have, all permanent incisors have 3 pulp horns, except for the maxillary lateral incisor, which may have between 1 and 3. And the canines do not have pulp horns as such, but the pointed incisor limit of the pulp cavity does correspond to the single cusp. So there are no cusp horns in the canines. So pulp horns in both maxillary premolars. Okay, so both maxillary premolars have 2 pulp horns. The mandibular first premolar normally has 2 pulp horns, but the lingual pulp horn may be absent. Okay. Whenever something may be absent, keep that in mind. And the white type mandibular second premolar, we have 3 pulp horns, and the H type and the U type have 2 pulp horns. So the permanent molars normally have 4 pulp horns, okay, in each. So the anterior teeth usually have 3 pulp horns, except for the maxillary lateral incisor, which may have 1 to 3, and the posterior teeth generally have 4 pulp horns. On a newly erupted mandibular first molar, there may be 5 pulp horns. Okay. Now, the pulp canals of the anterior teeth. The permanent anterior teeth normally contains 1 pulp canal. About 2% of the time, a mandibular incisor may have 2 roots, okay, and 2 root canals. You actually, not 2 roots. The mandibular incisor may have 2 root canals. That's actually common. And about 6% of the time, mandibular canine may have 2 root canals. And the mandibular canines are the ones which are more likely to have 2 roots. Okay. So maxillary central incisor, this is a mid-root section, cross section. So a cross section of the root of maxillary central incisor is somewhat triangular in the cervical and middle root section. So in the incisor view, you can also see that there's a triangular shape. Okay. Maxillary central incisor, the mesiodistal cross section. This is a drawing, okay, which represents the pulp cavity of the maxillary central incisor on a young patient. You can see 3 pulp bones there. Mandibular central incisor cross section. So you have the mesial and distal root concavities are present, okay, here and here, and the root is thin mesiodistally, okay. All right. So maxillary first premolar mid root cross section. So they have a single root at the mid root cross section. So single root, the mid root cross section is often referred to as kidney shaped, and the root concavity is on the mesial surface. However, remember that maxillary premolars, they have bifurcation of the root, so they may have 2 roots after bifurcation. But the mid root cross section is going to show 1 root and 2 canals. Maxillary first premolar mid root cross section. So this is the mid root cross section of the maxillary first premolar. It is with a laminated root. Okay, so meaning you see 2 layers here. All right, so that's called laminated. All right, and the deepest concavity is the mesial surface. So the concavity of the mesial aspect of the root is very prominent. Maxillary first premolar may have 3 roots. Okay, a small second buccal root is located to the distal. So maxillary first premolars may have 3 roots, and mandibular canines may have 2 roots. Okay. The pulp canals of the maxillary first premolars. So about 70% of the time, maxillary first premolars, we have 2 pulp canals with separate foramen. Okay, 70% of the time. 70% of the time, 2 pulp canals with separate foramen. 2 pulp canals, 70%. And 15% of the cases, there will be 2 canals and 1 foramen. Okay, 7% is 2 canals and 2 foramen. 15% is 2 canals, 1 foramen. 5% is going to have 3 roots, 2 buccal roots. Okay, remember that. So if you remember, you have to remember that if the tooth is going to have three roots, where are they going to be? So it's going to resemble like a maxillary molar with 3 roots. Okay, 2 buccal, 1 lingual. And 10% of the time, there's going to be a single canal and 1 foramen. Mandibular molars, the mesial root cross section. Okay, so you have the floating of the mesial and distal root surfaces, which is very common. And so floating is having concavities with some linear depressions. Okay, there are 2 canals in the mesial root of a mandibular molar. 2 canals in the mesial root, and the distal surface of the root is the proximal root surface, least likely to have root concavity. Okay. So the mesial root, the mesial root of the mandibular molar, excuse me, has two root canals. Okay. So here, the monkey face. So here, when you come to this tooth here, this is when you see this, which looks like a monkey. Okay. And I put a monkey face here so I can help you remember. This is a mandibular first molar. Okay. So there are two mesial canals and one distal canal. So this is a tooth which has 5 cusps, but it has 3 canals, sometimes 4. Okay, and sometimes it has 2 mesial, 2 distal, but usually the most common is 2 canals in the mesial and 1 canal in the distal. The outline of the cervical cross section resembles the occlusal outline of the mandibular molar, and the outline, okay, of the chamber is trapezoidal. So when you do a root canal preparation, it's more like a trapezoid. Okay. So the pulp canals of the mandibular molars, usually the mandibular molars normally have the 2 roots and 3 pulp canals. 2 canals are in the mesial and 1 canal is in the distal root, and about 30% of the time, the mandibular first molar will have 4 pulp canals. That means 2 canals in each root. Okay, so meaning 2 canals in the mesial root, 2 canals in the distal root. All right, and so for maxillary molars cross section, so there are 2 buccal canals and 1 lingual canal. The lingual canal is the largest of the 3. Okay, remember that. And the outline of the cross section resembles the occlusal outline of the maxillary molar. In the cross section, at the level of the floor of the chamber is triangular. So usually when you prepare endodontic access, you do a triangular access. In the cervical cross section, the outline of the pulp chamber is rhomboidal. So different, okay? In the cervical cross section, the outline is rhomboidal, okay? Maxillary first molar mid-root cross section. The mesial buccal root has fluting, okay, which is concavities, the mesial buccal where the green arrows are pointing. So these the mesial and distal surfaces, and it normally has 2 canals. Okay, so the mesial buccal root normally has 2 canals. Mesial buccal root normally has 2 canals in the maxillary first molar. The lingual root of maxillary molar is the only root that is wider mesiodistally than facial lingually. Okay, the only root that is wider mesiodistally than facial lingually is the the palatal root or the lingual root of maxillary first molar. And 60% of the time, maxillary first molars have 3 roots and 4 canals, with 2 canals in the mesial root. Okay, so that's the MB1, MB2. So the most common variation is the 3 roots and 3 canals. All right. So normally you have 3 roots and 4 canals. Okay, but when there's variation, most of the time you see 3 roots and 3 canals. On the maxillary first molar, so the vertical root concavity may exist on the lingual surface of the lingual root. So the palatal root has a lingual concavity, and as we saw in the previous lecture, okay, sometimes there is the facial surface of the palatal root also has a concavity. Okay, the root concavity may extend onto the crown. So usually they ask which of the following teeth have root concavities that may extend onto the crown. You have maxillary first molar, maxillary first premolar, okay, and you have the mandibular first premolar. So a vertical depression on the fascia of the lingual root has also been described. I mentioned that already. So these are the concavities where the green arrow is pointing. So the concavity and fluting exists on the proximal surface of the Mesiodistal root. So you may have some concavity on the palatal root, and also you may have concavity on the facial surface of Mesiodistal root. Not on the facial surface, but on the proximal surface. So the root concavities may also occur on the mesial root of the maxillary second molars. All right, that's the end of this lecture. If you have any questions, you can email me at dentalboard at dboardexams.com. Okay. All right.